This is Peg Stern in the Biofeedback Wellness Studio. Thank you for taking time to watch this video. We'll be looking at footage from a biofeedback session measuring 2 of the 5 parameters we can monitor with general biofeedback. The blue line that you see represents the client's breathing pattern. You will see this blue line rise with the inhale and return to baseline with the exhale. So it appears as a series of mountains on the screen. This is measured with a belt placed around the client's waist, and this belt measures the expansion of the abdomen as the client breathes. The pink line represents an indirect method of measuring the heart rate using a sensor attached to the finger. Each stair step indicates a heartbeat. As you watch the pattern, you'll notice that there's very little relationship between the breathing pattern and the heart rhythms. This is typical of most clients early in their biofeedback training. For most of us, our breathing rates tend to be faster and higher in the chest when we're not conscious of them. Eventually, we will see the breathing pattern slow as the client is coached to slow their breathing and to use the diaphragm to move the abdomen out with the inhale and then to allow it to come back in with the exhale. As they are doing this, the client receives feedback as they are watching this same screen or a similar one as they breathe. We're beginning now to see the slower diaphragmatic breaths. And with this, we see the heart rate begin to respond and to synchronize with the breathing pattern. We see the heart rate increase with the inhale and decrease with the exhale. This client has slowed the breathing to about 5.5 to 6 breaths per minute. Research shows that for most people, a rate between 5 and 8 breaths per minute provides the most health benefits and creates balance in the autonomic nervous system. Most of us won't maintain this slow rate during our everyday activities, but with practice, we can draw on it whenever we feel stressed, perhaps using it several times a day to help lessen our stress response. Combining it with relaxed muscles, decreased sweat gland activity, and warm hands can be a really nice place to be. This allows us to create the rest and digest response, which is the opposite of the fight-flight response. This client is doing a very nice job. Every now and then we get a little glitch. This can be an awkward thing to do when we're accustomed to breathing faster and in our chest. So it takes some practice. We have a very nice synchronization happening here with the heart rate as it rises with the inhale and decreases with the exhale. With regular practice, we can learn to enhance the difference between this higher heart rate at the top of the inhale and the lower heart rate at the end of the exhale, thus improving our heart rate variability. Research tells us that increasing the heart rate variability can lessen the stress response, decrease anxious thoughts and feelings, enhance cardiovascular and pulmonary health, improve asthma symptoms, blood pressure, sleep patterns, and perhaps even the immune system, decreasing inflammation, and perhaps even improving cognition. Some Olympic athletes are using this as part of their training for readiness for the competition. You too can create this pattern with regular practice. If you're interested in receiving some coaching and feedback using biofeedback, please give me a call at the Biofeedback Wellness Studio. Thank you for watching.